I'm Emma Halper, and I'm here to talk about a manuscript that we recently published in the Sexual and Reproductive Health Matters Journal on abortion access in Costa Rica, which is especially timely with International Safe Abortion Day approaching on September 28th. Costa Rica is acclaimed for having some of the most progressive social policies in the Latin America and Caribbean region, especially in environmental protection and immigration. However, when it comes to sexual and reproductive health and rights, the landscape is far more complex. Abortion remains highly restricted, only permitted to save the life of the pregnant person. Global research shows that restricting legal access to abortions does not stop abortions from happening, it simply forces them into unsafe conditions. Data is not available on the safety of abortions in Costa Rica, but the Guttmacher Institute estimates that approximately 41% of all unwanted pregnancies in the country end in induced abortion. So why is this study important? It sheds light on the specific barriers people face in accessing safe abortion services in Costa Rica. While legal and moral debates surrounding the topic are well known, there's limited research on the practical obstacles individuals face when trying to access services. And this isn't just an academic issue, it's a public health one that also disproportionately impacts individuals from historically marginalized communities, including migrants, refugees, indigenous populations, and those with limited financial resources. We explored these challenges using the socio-ecological model, looking at individual, interpersonal, community, institutional, and systemic levels. We identified a complex web of factors that impact access to care, spanning from personal and religious beliefs, migration status, access to social networks and financial constraints, to societal stigma, health facility type, and policy gaps. A key finding was the lack of standardized training for healthcare providers on legal abortion provision in the national abortion policy, which leads to uncertainty, hesitancy in providing care, and a lack of information for patients, likely affecting both the quality and availability of services. These barriers not only impact individual health outcomes, but also perpetuate inequalities in healthcare access. Addressing these gaps is essential to ensure that everyone, regardless of their resources and their documentation status, has access to the care that they need. Our study highlights the need for targeted interventions to improve access to sexual health education, enhancing healthcare provider training, and tackling systemic obstacles. Ultimately, we advocate for a more equitable and supportive healthcare environment in Costa Rica that respects and upholds every person's right to make informed choices about their reproductive health, and where the fundamental right to health can be fully realized for all. Thank you so much for joining me in this important conversation and for supporting the ongoing efforts to enhance reproductive health care access in Costa Rica and beyond.